Hey guys, Dr. Adam Tice here. Welcome to today's office hour session, and today we're going to talk about digestion as the origin of health, and specifically today I want to talk about the anatomy and the physiology of the digestive system. It means, like, what is the digestive system? So I want to go through and talk about number one, the components, like what are the parts of the digestive system, and then secondly, what are those parts doing? So it's like in medicine and in science, we have this saying like structure determines function. That's like the basic kind of thing. If you've ever taken any science classes, any anatomy, any physiology, anything like that, structure determines function. And that's what I want to go through today, because so much of what I talk about, and so much if you're interested in understanding and kind of wrapping your mind around number one, being able to wrap your mind around like how to naturopathically, holistically care for your family. Okay, you got to wrap your mind around that and cross that bridge, make that paradigm shift, which is super important. And that I think more and more people have done, and now a lot of people are in this territory where they've exited the medical matrix, and then everybody's a little bit in this no man's land. It's like we're all like crossing the bridge, crossing the paradigm on the way to the new paradigm where we are firmly rooted and hardwired in our knowledge and our wisdom and our practices about how to take care of ourselves and our families. And the whole point of this session today, if we're doing those things, digestion is the command center, which we talked about last week a little bit, and we're going to just go deeper and deeper into that this week. Structure determines function. This is part of the strategic intelligence and the infinite wisdom that the divine creator has, and that is made evident when we look at this. We're like, man, that is the perfect design. And it was designed like that perfectly, with perfect forethought and perfect intelligence to do something, to do a job, to perform a function. Structure determines function, and this is something that's really magical. Okay, that's kind of the high level. So now I want to go through and you guys can follow with me here. I want to go through each organ of digestion, and let's make our way down, and we'll kind of highlight a few things there. So I want to go through, again, the kind of flow for today is going to be going through the anatomy, the structure, going through some of the basic physiology, and we get the understanding of that, because that's what the key to the digestive process is. We're going to talk a little bit about that. Things like enzymes and digestive secretions and stuff like that. Things that are going to do the digestive work. And then I also wanted to mention kind of along the way things that go wrong with that system. So digestive symptoms and things like that. So we're going to bring out some protocols, and I'm going to start to introduce some of the naturopathic protocols, some of the high level things that people can do. And then that'll tidy up, probably 60 or 70% of for a lot of people. Then that other kind of 20-30%. But they're going to need something else. They might need there's something else to the picture, some other piece to the case. If you're doing good things, this is what I do as a clinician. It's like if I'm doing something and I'm employing, if I've created a personal protocol for somebody, a digestive protocol, for example, and we employ that protocol, I expect things to change, and digestive symptoms especially. And I tell people this, I expect digestive symptoms to resolve following my digestive protocols within days. And days to weeks, certainly I want resolution. And if a symptom is not eliminating, reflux, bloating, constipation, diarrhea, stomach aches, cramping, any of that stuff, that's the most common stuff. If any of that stuff's not resolving with the protocols, then that's when we have to loop around and be like, what's the rest of the story? What else? Okay, so that's just kind of a clinical tidbit. Let's go through here. Introduction to digestive physiology and anatomy. The role of the digestion is the interesting process. Okay, here we go. Digestion is the interesting process because it goes from here and then goes through the system. And we've said this before, but it's so interesting. This tube, this mouth tube, this gut tube, is the only part of the inside of the body that is exposed to the outside. So something from the outside we're going to put in our body, and it's going to go through, and that is one of the reasons why the immune system is seated there in that gastric associated mucus tissue, in that lymphoid tissue in the digestive system. It's got to be doing the immune work because it's exposed to the outside. So process of digestion actually begins even before food enters the mouth. This is the Pavlov experiment, right? Where we hear the dinner bell ringing and we begin to salivate. That is the body's way of beginning to secrete salivary amylases and these digestive secretions in anticipation of the coming nourishment. And then the body's getting ready for that and doing its job to do proper secretions so we can start to break that down. Journey begins. Mechanical digestion is in the mouth and the teeth. Then the digestive secretions begin. The carbohydrate secretions usually begin first. The salivary amylases, those are the ones that are going to be breaking starches and those starchy carbohydrates down. And this is why we'll say chew the food good, and Ayurveda teaches us to chew the food basically until it's liquid. And this is a good thing. This is something somebody should have taught us when we were kids. I don't think anybody taught us how to do that. Most people I know just like chew the food so big and they just, eat so fast, and we don't chew properly. And these are just real simple, common sensey things that I don't think a lot of people know. Chew your food completely. Chew your food until it is liquid. Then it's that will take some of the load off of the digestive system so that food can move through. Then the food is going to travel down the esophagus, that's the throat, and coming down through here. This is where you'll have issues like reflux and heartburn will start to affect the tissue of the esophagus. And if that goes on and on and on, that actually can lead to an esophagitis, which is a long-term inflammation of the esophagus. And that can actually evolve into a cancer if it's unaddressed and untreated over a long period of time. So we don't want to irritate that tissue. If there's something that we're irritating the tissue, if there is reflux going on, the number one thing guaranteed that might fix it just alone. I've had this, but I'm speaking from experience, like multiple times, many times. I've done nothing other than remove the food intolerance. Identify the food intolerance, remove the food intolerance, clean the reflux up. Only after that would I give other things that might soothe that inflamed tissue. Otherwise, that's functional medicine. That's still a this for that. Oh, I take this for my reflux. And I use things like that. And I'm going to put a reflux protocol together. But the important thing to know is you need to know that reflux product, and I use DGL, is one of the main, which is a deglycerinated licorice. I use that. It just soothes the tissue. There's an old naturopathic formulation that we use that has demulcent herbs in there, but the DGL works really nicely, and that's what we can use. As long as everybody knows that that's functional medicine, that is palliative, it's going to address the symptom, but it's not going to identify and remove the cause of that symptom. So we're following the journey. We're going down the food tube, down the esophagus, and then we pass through the lower esophageal sphincter, which is like a hole there, and then we pop out into the stomach bag, into the food bag, which is the stomach. This is a chemical mixing bag. It's an acid bag. Secretions of HCl and other things. HCl primarily is then going to serve to start to break apart and cleave apart some of the proteins. So if the acid, gastric acid, HCl, pepsin, other enzyme secretions, there are other things in the fat in the stomach, like intrinsic factor and things that are going to be integral in beginning the story of assimilation, of nutrient assimilation. We're about to get there. But in the stomach, we're in the chemical mixing bag, and the pepsin and the HCl and all that is churning and mixing all that up. And so if that stomach acid is too high or too low, you're going to have issues. If it's just too high, then that's going to be pure reflux. That's pure fire. If it's too low, that's going to lead to diminished and slowered stomach emptying time, which then can also lead to regurgitation and reflux episodes and things like this. So you see, if it's too high, you have an issue. If it's too low, you have an issue. We really need those stomach secretions, those gastric secretions, to be dialed in really perfectly. And this is what the body is marvelously designed to do, is give just the right amount of, it keeps everything in a dynamic, homeostatic, to say like a moving way of balancing things. And so the body is going to dial things up and down for you. And this is individualized. This is individualized. Some people have predispositions to have more stomach acid or less stomach acid. So you got to look at this at a case-by-case basis. Continuing the journey. We leave the stomach, then we enter into the small intestine. This is going to be the primary site of nutrient absorption. So nutrient absorption, this is where most of the action is happening. And they say, you are not what you eat, you are what you ate, or you are what you absorb. So if we're eating good quality foods, we got to make sure that that we are actually absorbing what we're eating. So the small intestine is going to be responsible for that. And that is where most of the absorption takes place. And that, now if you have inflammation in the digestive system from, for example, in something like Crohn's or some of the other issues, or even just say an IBS or a leaky gut, because that would really be a small intestine issue. And what's going to happen over time, if a person is eating their food intolerance, there's going to be some level of inflammation in the body. There's going to be undigested foods, going to be microtoxins and some toxemia going into circulation. And what that does is over time it causes little small damages in the mucus lining of the intestine and things like that. And just to kind of give you a visual on that, just feel the inside of your cheek and feel like soft that tissue is and how sensitive it is if you just like bite it just a little bit or anything, accidentally or intentionally. Okay? How fast does that heal up then? If you mess with it, it's going to stay sore and get sore and like that. But if you leave it alone, it will heal up. But if you mess with it and there's constant insult to that injury, which is basically what happens when there is undigested foods, maldigestion happening, microtoxemia that's going on, that's basically causing a microinflammation. That happens over time. Eventually that tissue gets inflamed, and eventually if it goes on long enough, there can be a thickening of that tissue also. And what ends up happening is the immune system gets deranged and confused. What ends up before that is that the absorption ability of that tissue becomes compromised. So you don't absorb. You don't absorb optimally, and you may not absorb at all, depending on how long that's been going on and how extensive that damage is. So small intestine, super important. Anti-inflammatory diet will heal that up. Therapeutic diet, as I prescribe it, will heal that up in 2 to 3 days, because that's it's actually gonna, the whole cellular lining is going on the gastric system is going to turn over and regenerate every 2 to 3 days. So I don't know if you guys know, but every cell in our body, every tissue, every system is regenerated. So literally, you're not the same person that you were 12 months ago. You're not the same person you were 5 years ago. You literally have different constituents that the body has recycled and remade, and in that way you're reincarnated every day and you have remade yourself over the course of a year. So that's why health changes, people change. You're literally remaking your body. Continuing the food journey from the small intestine, which is the primary surface area of absorption, is the small intestine. Then we're moving to the large bowel, the large intestine, and the primary function of the large bowel is actually not so much nutrient absorption, but more fluid absorption, hydration, water absorption, and then waste elimination. So these are this is the big thing. This is where the microbiome is super duper important here, and this is really where IBS, this is where bowel diseases, you'll start to see some issues. So again, if you have inflamed tissue in this area, from an improper diet, from eating the food intolerance, from just improper lifestyle, this, depending on the individual's genetics, their constitution, their susceptibilities, their karma, their lifestyle, all these things will determine whether you're going to have a stomach issue or small intestine issue or a large intestine issue. And again, if there is large intestine issue, the main thing is to make sure that the microbiome is diversified and that the hydration status is there, and that people are having mineralized water that will allow that mineralized, energized, and structured water that's actually going to allow that water to actually be absorbed into the system. So if there are issues with the large bowel, constipation, diarrhea, spasmodic bowel, it's the main things. Again, where do you start with any kind of digestive issue? Identify the food intolerance, remove the food intolerance. The most common food intolerances that I see, and when I put people on therapeutic diet, means I'm not sure what the food intolerance is, but if I want to jumpstart the case and get things going, here's what I do. I take people off wheat, dairy, potato, egg, sugar, soy. Those are the usual suspects. Wheat, dairy, potato, egg, sugar, soy. Remove all those things. Basically put them on like a meat and veggies diet and see what happens, because that's an anti-inflammatory diet and most people are going to respond well to that because it's easily absorbed nutrients. Now, as far as how do we rehabilitate the digestion, I'm going to go over that section in the protocols section, and then we'll speak to each of that. But basically, high level, what do you need to do? We need to identify what foods are not digesting, identify the food intolerance, remove that food intolerance. Then we need to do some things to stimulate the digestive fire, to tonify the digestion, and to support the digestion, make sure we have all the enzymes and factors that we need on board to help break down those foods. So that's high level what we're doing, and that high level will take care of, that will take you a long way. I say high level, but that's super special advice, and don't be fooled. The elegance in this whole thing is in the simplicity. It's real easy to get real sophisticated and real fancy and have some fancy looking protocol or whatever for, gut rehabilitation. And sometimes you need a fancy protocol, but most times you don't. The magic in this whole thing is finding the elegance in the simplicity and seeing what is the most simple, most simplest, most likely path that can get a person better. And that's, you have to have some intelligence and some skill to be able to do that. Because when people just start out doing things, they got so much information going on in their head, it's real easy to get it real complicated. And sometimes sound like, smart about it. But the real magic and elegance in really any case, but certainly, and really for me, every case begins in digestion. That's why I'm spending so much time talking about the digestion and these foundational understandings about digestion. Because if you want to fix really any inflammatory condition, whether that has to do with hormonal issues or blood sugar issues or inflammatory issues, or any of those things, you need to go to the gut. Because if you have hormonal issues, guess what? You have digestive issues. If you have menstrual issues, guess what? You have some digestive issues and you have some detoxification issues. If you have head pains or migraines or any kind of head pains, you have digestive issues. Guaranteed. Guaranteed. I've been doing this long enough to know and see. So if you go chasing headache or chasing inflammatory symptom and you don't go to the digestion, you'll end up chasing your tail. And you'll end up in that cycle of trying to find supplements that fix things, and they might work for a day or two, week or two, month or two, but then the symptoms will come back because we did not identify the root obstacle to cure. Another part of the digestion is, and we've mentioned this along the way, and we're kind of touching on it now, and it's super important, and it's to say if you have there are components of digestion that catalyze and make that process happen. And one of those things, we've mentioned this before, but we haven't really said too much about it, is the digestive enzyme process. But before we go there, there's two other organs of digestion that I don't want to skip over: the pancreas and the gallbladder. Pancreas and the gallbladder. The pancreas is primarily going to be responsible for secreting enzymes, digestive enzymes. And we can look specifically at the beta cells, the pancreas, and things like blood sugar metabolism, and those all need to be intact, functioning properly. So we need to understand, again, the anatomy, the structure and the function of that. Enzymes are coming from the pancreas. And then in the other organ of digestion that I want to mention is the gallbladder. And this is a little bag type, a sac type organ that is nestled right there with the liver, and it works really kind of hand in hand with the liver. So the gallbladder and the bile secretions in there are specifically for the purposes of what we're talking about today. That bile is essential for fat digestion, dietary fat digestion, and nutrient absorption. So if you have any kind of stagnant digestion, and this usually is most common clinically in females once they've had a couple of kids, they get into their 40s, there might be a little bit of thyroid issue, maybe some trouble, losing weight after babies, or maybe just with age. The gallbladder needs some support. Gallbladder needs some support. The classic gallbladder attack kind of a picture is where you will feel that gallbladder spasming, and you will feel it behind the right shoulder blade, because the gallbladder is right here, and so directly back behind there you will feel that spasming. And I've had people report that a lot. Those are usually early signs, but those have been going on for years. So if you're having any kind of food stuck sensation, if you're having any kind of those early gallbladder stagnation signs, if you are having, and the telltale sign that there's gallbladder insufficiency is if you have urgency for stool immediately after a fatty meal or a heavier meal. You cannot break down the dietary fat, and that dietary fat will send an urgency for bowel movement to eliminate. Telltale sign that the gallbladder needs some help. So I will use a gallbladder support product, and I'll put this in the protocols. A gallbladder protocol. We'll put that in here, but to say it's not so much about like what product you use or whatever. I'll show you what product I use. I use kind of a 3-in-1 product, and that product has, this is why I use it, I try to find a product that has bile, that has, and it is generally an ox bile that they use. So that bile, and then I like to make sure that there is some HCl in the enzymes and some of the enzymes that are going to help to break down the dietary fats and the proteins, and then all of the amylases and everything that we need to break down the carbohydrates. So I use a product that has all of those in there, so it's just one product. I have people take it like right along with their meals or just before their meals, and certainly travel with those kinds of things. That's how I support the gallbladder. So those are organs of digestion. Now, I want to say one thing, and I'm going to introduce something because I've been doing some deeper research, and partly what I'm doing in these office sessions is getting all this foundational content that we need we need to be on common ground and understand all this, because I want to take you guys deeper into the next level. This is old news for me. This has been in my brain for a long time, 10 years plus. And so all that time along, we have much research that I want to give out and talk to you guys about. And I'm going to just briefly introduce one of those fascinating topics of interest as it pertains to the enzymes specifically. The enzymes in the body are a quantum mechanism, and we are on the cutting edge of science and enzymes, and the reason the enzymes are so important, they facilitate the digestion, but they do an interesting thing where they do something, they basically allow something to cross a boundary that is there, and they should not be able to cross that. So there's something happening, a quantum enzymatic tunneling effect, where the enzymes allow a tunnel to open up for that transition and that activation of that enzyme energy to happen. This is some quantum medicine, part of the field of quantum medicine and quantum biology, and enzymes are a super interesting topic of this, and we're going to be introducing some of this other quantum enzymatic tunneling as it relates to quantum medicine and quantum biology, and attending to the full biofield fitness. Okay, this is next level where we're headed. The anatomy and the physiology of the physical body we have to understand before we go into the deeper levels. So I hope this has been helpful to lay this out, and and again, structures, determining function. We've gone through the anatomy and some of the basic players of the digestion. And again, this is prevention through digestive care, because digestion is the command center, and we can activate the prevention really through digestive maintenance. And so we can look and see if there is any issue, chronic health issue. When I take these cases, just based on my experience, what my experience has shown me is if I'm taking a chronic case, means there's a bunch of health issues, 1, 2, 3, 4, 5, 6, 7, 8 symptoms, a lot of things going on many times. There will be accompanying digestive symptoms. And many times, if I ask questions, which I do, and unpack and kind of trace back and unwind a person's story, we will find out that early on, or maybe even as a child, there were digestive issues. So it might take 2 years, 5 years, 10 years, 20 years, 30 years of a compromised digestion that will lead to, over time, low levels of absorption and low levels of nutrient assimilation, which will over time lead to insufficiencies and deficiencies, will lead to malabsorption, will lead to toxemia and microinflammation, will lead to further inflammation based on individuals' genetics, tendencies, lifestyle habits, karmas, everything, will give the readout of what symptoms that person experiences. The magic in the medicine is in maintaining the digestive health. That's how you prevent disease. And it's how you go back and you unwind and you fix or you address disease or imbalance in the body, dis-ease, something in the body. So I hope this helps to kind of connect some dots and understanding that if you have some symptom and you think that it's something else, again, headache, skin stuff, hormonal stuff, if you think there's an issue with mold, if you think there's an issue with your adrenals, if you think there's an issue with anything, any other pathology or system, if there's an issue with your blood pressure or an issue with the heart, some other issue, if there's issues with the lungs, if there's issues with asthma, respiration issues, guaranteed there are issues with digestion. And if you understand the structure and the function, you understand the anatomy, you understand where things are happening, you understand that the digestive process means all the organs of digestion, the anatomy, the physiology, that it means the process of digestion. It means digestion, absorption, assimilation, elimination. All those things have to be on. It's all got to be on track for the digestion to be happening. This is how we maintain health. This is how we prevent imbalance and disease. And if there is anything going sideways in the system, means any kind of symptom going on, especially if it's like obviously a digestive symptom, go to the gut and fix it. Go to the gut and fix it there. So this is a good starting point, for us to understand this, a good pause point here for us to pause our conversation here. So kind of at this point, we've gone through this, and I would invite you just to scan through your body and think about, how's my digestion? Do I have any issues? Do I have any reflux? Do I have any bloating? Do I have any stomach aches? Any stuff going on? Do I have any symptoms going on that maybe I thought I had, maybe I didn't think all the way through about the digestion? These kinds of things. So scan through, double check, see if you have something going on. If there is, I would invite you just to kind of take an inventory on that, tidy it up now, fix it up now. We will be uploading other protocols, and I will have a section for those, and you guys will be able to see and plug and play those, and then of course ask me any questions you have about those. That's a good place to pause here right now, guys. Digestion, still the command center, structures determining function. Hope this has been helpful for you guys. You guys DM me questions, let me know your questions, what questions you have about the session, and we'll continue our deep dive and take it deeper. Okay, adios for now, guys.